Dealing with the knowledge of having a life-threatening disease such as cancer can be highly stressful, frightening, and can make anyone feel totally isolated and alone. The CCA, the Colon Cancer Alliance, is a national patient advocacy organization that understands the plight of those affected with colorectal cancer. Their work is dedicated to raising awareness of the disease, increasing screening rates, providing patient support through educational events and materials, and ultimately ending the suffering caused by this preventable disease.
Colon and rectal cancer represents a malignant tumor of either, some people call it the small bowel or small intestine, but it is a malignancy of the colon. It is the third most commonly diagnosed cancer in the United States, and yet it is the second leading cause of cancer death in this country.
With humble beginnings as an online support community, the Colon Cancer Alliance was founded by a small and dedicated group of individuals whose lives have personally been impacted by this disease.
The CCA was started by a group of colon cancer survivors and people that were interested in the disease because a family member or friend had the disease. And today it's now grown to be the oldest and largest national patient advocacy organization for the colon cancer patient.
Not unlike other cancers, no one knows the exact causes of colorectal cancer. Doctors often cannot explain why some develop the disease and others do not.
This cancer occurs more commonly in individuals over age 50, and as well, it occurs more commonly in individuals who have a family history of colon cancer. Yet, the majority of individuals with colon and rectal cancer have no family history of the disease.
Few, if any, symptoms associated with colorectal cancer appear when the cancer first develops, but there are some common signs to look for.
Many individuals with this cancer have abdominal bloating. There can be rectal pain. Sometimes there's blood in the stool or change in bowel habits. And yet for many individuals, there are absolutely no symptoms of the disease.
Studies have shown a correlation for colorectal cancer between ages, ethnicity, and race when determining the incidence and prevalence of developing the disease.
9 out of 10 new cases that are diagnosed in this country will be in individuals who are over age 50. Yet, there are individuals who will develop colon and rectal cancer at a younger age. And in fact, the younger population is our fastest and increasing segment of the population that has this cancer.
Research shows that certain people with known risk factors are more likely to develop colorectal cancer. These risk factors may increase the likelihood of developing colorectal cancer.
There are some genetic factors. There are also some non-genetic, or what we call environmental factors. Genetic factors can include anyone with a family history of colon and rectal cancer or a family history of other cancers. The environmental causes are several, including smoking or a history of excess alcohol consumption.
Regular screening for colon cancer is the first and most crucial step in preventing precancerous colorectal polyps from becoming cancerous. Early detection allows treatment to maximize its impact, making the disease highly treatable. Screening can be the most effective way in which to save lives. There are numerous screening methods available, such as colonoscopy, virtual colonoscopy, flexible sigmoidoscopy, double contrast barium enema, digital rectal examinations, as well as home screening exams such as fecal occult blood test, fecal immunochemical test, and the stool DNA test.
The earlier the stage of diagnosis of colon and rectal cancer, the better the overall survival. Therefore, screening and early diagnosis are very important parameters that can save lives.
If the diagnosis for early screening results suggest cancer or symptoms that are indicative of colorectal cancer, the doctor must determine if they are due to cancer or some other cause. If results are negative, no treatment may be needed, and follow-up checkups may simply be prescribed. Should tests show any abnormality, such as a polyp, then a biopsy will be done to check for the existence of any cancer cells.
Well, colon and rectal cancer, for the most part, is preventable. And it is preventable because with early screening, polyps can be removed. A polyp removed during a colonoscopy will never become a cancer.
Treatment options depend largely on the location of any tumor and the stage of the disease. These options may involve surgery, chemotherapy, biological therapy, or radiation therapy, or even a combination of treatments. Advocacy is just as crucial as the medical and pharmaceutical work being done in the prevention and curing of colorectal cancer. The CCA is a leader on healthcare issues on the Hill. The Colon Cancer Alliance raises awareness concerning colon cancer through its nationwide series of educational seminars, innovative special events such as the Undy 5000 Run Walk, and National Dress in Blue Day, its online support groups, informative website, and a 24-hour helpline which assist hundreds of thousands each year.
We also provided patient education to those who are already affected by colorectal cancer, and one of the ways we do that is through a new online community called mycrcconnections.com. And people that go to that website are able to create pages, personalized pages, in which they put their own information on there and their own stories, and they're able to tell their story and then share that story with family members and friends and other people that are similarly situated. The Stars Go Blue is the Colon Cancer Alliance's attempt to engage the entertainment industry to help raise awareness of the disease.
Because colorectal cancer does not always produce symptoms, the message regarding education, prevention, and screening becomes one of the greatest assets the CCA implements in order to save lives.
Colorectal cancer is the most preventable cancer out there. Up to 80 to 90% of people can avoid this disease if they would simply talk about it and get screened. So the Colon Cancer Alliance highly encourages people to have a conversation with their doctor about colorectal cancer screening. We know that if people would screen for the disease, they can prevent the disease by getting to the polyps in their colon before those polyps turn into cancer.
For many, colorectal cancer can be an embarrassing or uncomfortable topic.
It is one of the more invasive screening processes that people can go through, both men and women, for cancer. Because it is a taboo kind of area and subject, I think people forego it just because they don't want to deal with it.
Ever mindful of the dilemma of those who develop this disease, the Colon Cancer Alliance set their goals on developing new approaches toward raising awareness, expanding upon current programs and support initiatives, while increasing federal funding for research and advocating for uniform standards of care for patients.
The vision of the Colon Cancer Alliance is a world without colon cancer. And for this disease, that's an attainable goal.
Get screened, be aware, get the test done when you need to get it done. It's as simple as that. It could save your life. It saved my life.
For more information on the Colon Cancer Alliance, visit www.ccalliance.org or call their helpline at 877-422-2030.